Hello, I am Professor Mario de la Torre, Scientific Director in Quantel Medical by Lumibird. And for me, it's a pleasure to be here with Dr. Jean-Pierre Guillon. He's a passionate for 40 years in ocular surface disease and ocular surface research. I learned a lot of your publications. That was the time that nobody was interested in dry eye, and they didn't discover this fascination and this fascinating area that we already are trying to develop, not only in the diagnosis, but also in the treatment. You have a scientific understanding of the problem, and I'm very happy to be with you right now. You have your PhD publication in 1986, the tear film of the contact lens wearer. That's very important at that time. I think until now is a very, very important issue. You also developed the tearoscope device, and the most important contribution to our understanding about dry eye is your scale, your grading scale, that is accepted in many, many publications. I'm very happy to conduce this introduce to you, just because we want you tell us what is the interferometry as a concept and how important is to quantify that.
Thank you very much. First, I'm absolutely delighted to be able to participate, with the diagnosis of the problem with dry eyes. As you mentioned, it was far back in the 80s where most of my research has been made. And it was based on the principle of interferometry. Interferometry is, in a way, as simply as we can put it, is a combination of two rays of light in a specific way that can either be enhanced and double the amount of light which is reflected or nullified. So if we use a monochromatic light, you'll have a dark zone and a light zone. That's for laser, for example. What it is different for the examination of the ocular surface is that we have a layer of oil at the surface produced by meibomian glands, and the oil I call lipids. This oil is so thin that when we illuminate it with a general white light, it produces color of interference within that very tiny zone. The same way as we see in a soap bubble or oil on water. And that's the basic principle that drove me to illuminate the ocular surface with the telescope, analyze the colors that I was seeing, and create the grating scale, the Guillon lipid grating scale.
I was very surprised. Have you understand this wave of the lipid layer and also the colors that you can get? But now we can measure in another form, more scientific. Can you please explain something about that?
Yes. All these years, the only thing that I could do is observe and do subjective observation. I knew from the work of Newton that you could create a very specific range of color based on the thickness of a layer. Newton is a layer of air. In my case, was a layer of oil. The range and type of color were the same, but the thicknesses were different because we had a different refractive index. But that general range and change in color is exactly the same as Newton described. The difference is that because it's the ocular surface and the tear film, the inner blink rate, we have, instead of having a static situation, we have a dynamic situation. Now, as soon as we have that, that's why we required more objective measures rather than just subjective measures. It moves a bit quicker, a bit slower, it spreads everywhere. The big advantage of this type of instrument, like C.DIAG, is that it allows to give us first a record of what we see, but also to analyze very precisely both the colors and the speed of movement of spreading of the layer of lipid.
Yes. You, as worldwide expert in ocular surface examination, we collaborate with us in this development of the new C.DIAG. And exactly because the high quality of the images and also artificial intelligence is right now uses to examine that lipid layer. Please, can you tell us about your collaboration with us in the validation of all the algorithms that we use in our C.DIAG?
As I said, it was very important to move from the subjective to objective measurements. And the advantage of the C.DIAG is that because first there's a recording which is made, because for the lipid layer it's also a non-invasive system, but the analysis itself is a set of analysis that rely on the development with artificial intelligence for the development of specific algorithms which are related to each individual test that the C.DIAG can do. And that is not only the lipid layer, but also the non-invasive breakup time, the analysis of fluorescein, the analysis of the blink rate, the measurement of the tear reservoir as a tear meniscus, and I think most important is the imaging and analysis of the status of the meibomian gland by the meibography, because that, especially with aging, it will allow us to have a very precise measurement of the abnormality of this gland that produces the layer of lipids.
Then we agree that this has a high impact in the diagnosis and also in the knowledge of the ocular surface disease as well.
Yeah, oh, absolutely. Because especially with the aging population, which I'm one, there is those deterioration, and we go from physiological changes to pathological changes. And if I look at it, one of the most common abnormality that does occur is the deterioration of the meibomian glands that cause the most common dryness problem in the population. The imaging by direct and indirect mammography is what makes it so important, because we can visualize the abnormality. With that, we can advise the treatment which is required, and after treatment, you can verify the improvement that has been occurring following the treatment.
Perfect. And also, we have another features, not also interferometry, not also mammography. We have Nibud, blinking analysis, all the examinations. What is your consideration about that kind of features in our device?
Yeah, what is nice, it covers all the different features which are necessary to lead us to an acceptable and reliable diagnosis of a problem. Tear film is a very complex problem. It's multifactorial. And what is nice in the one instrument, which is very easy to use, we can have all those measurements in one place, which are analyzed objectively and then can be followed by algorithm that helps us in the diagnosis and the advice.
It's a decision tree as well.
Extremely. It's very easy to do, very easy to learn to operate. But mainly it's reliable because the measurement can be repeated very easily and does not matter, and it does not count on the individual operator or individual user. So just the use of the instrument make it a regular, reliable measurement wherever we are.
In other words, you can delegate it to someone.
Yeah, that's basically one of the most important. This sort of measurement, because it's very high and precise, can be done, can be delegated. And what the professional does is basically from the help, it gets both from the images and algorithm. It allows the professional to take the right decision as far as the treatment.
Doesn't matter, it's a dark eye, a blue eye, a green eye, or whatever.
That's exactly. It will apply itself. There'll be the same measurement applying itself wherever we are, whether is it Asian country, in a Northern European country, Northern African country, or South American country. There'll be the same type of illumination, same type of measurement, which we know are reliable.
Perfect. We were talking about the mebomography, and one of the features is the transillumination in red-free mode. And what is the impact to see the telangiectasia that are around the glandular acinis in the lid?
Of all the modules, I think that, especially technically, is the one which is the most important. As we age, the deterioration in the aging of the acini of the meibomian gland is the one which is the most problematic, because not only there is a pathology coming in, but the functionality is really lost. Now, because we can image and measure very precisely their status, it really supports the diagnosis and the advice of the use of IPL treatment. And in the same way, by using again the same technique of measurement, it allows us to see the benefit that the patient has received from the treatment itself.
A follow-up, you mean?
Absolutely.
And then this is very important in the inflammation process of all the ocular surface disease, especially in the lid.
There's never a full term solution, but what matters is a continuous care. The difference being that continuous care can now be done with objective measures, and it allows a very short time for the analysis and the treatment itself to be checked very carefully.
Okay, if you compare C.DIAG with another devices that's already in the market or they are already used by professionals, what do you think is the strength, advantage of the C.DIAG?
The main thing is that it covers every single aspect that need to be studied, visualized, analyzed for the protection of the ocular surface via the measurement of all those facets of the tear film that matter to get us to the right diagnosis and the right advice for treatment.
And what about the image quality?
It's amazing. One of the modules is such a high definition. It's very, very easy to see very small detail. The high quality is also important to enable the image analysis to be reliable. The quality of the image is primordial on that way. That's why it's so important.
I realize also we are using a devoted device for dry eye. It's not a keratometer, it's not another device. It's someone who is especially focused in the cornea and all the features as well. Then, last question. What do you think about the future in dry eye?
Because the problem is worldwide. It be independent of nations or where we are. It still be there. 20 years ago, 30 years ago, nobody cared because we did not know what to do. The difference is now we know how to analyze much, much better. There's new treatment that comes in. There will be new treatment and approaches. The advantage with the C.DIAG is that anything new, we can now test it. So we'll be reliable in knowing whether a treatment works, doesn't work as well, or works better than others. And that will give confidence to the practitioners.
Thank you so much. That means that right now we have the future of dry eye in our hands.